Many aspects of the NHS reforms focus on the financial aspects of patient healthcare. But without pilot studies, how do we know what the impact will be on the relationship between patients and their GPs? The 2010 GP patient survey shows that the public was generally quite pleased with the level of treatment they received from their GPs. More than 50% said they were very satisfied with what the doctor ordered. In addition, 84% of participants reported that they would recommend their doctor or surgery to a person who had just moved to the area. But the survey only covers a satisfaction with the medical and clinical treatment the patients received, and not anything related to finances. With the upcoming changes of the NHS, does the public trust the GPs with the responsibility of administrating the budget?
I would trust the GPs, but I think that there should be an external body to monitor what's going on.
I trust my GP at the moment. I have a great relationship with my GP, but he's about to get a whole set of responsibilities that he wasn't trained for. He was trained as a medical practitioner, obviously, and a whole load of budget and commissioning responsibilities are about to come these people's way, and I think that's going to be challenging.
Adding extra pressure on the GPs may result in them having less time spent with the patients and allowing them to actually do their job, which is just cure the sick.
I guess when you're in the profession itself, you can see firsthand what should be done and what needs to be done, and develop an overall balance of how resources should be distributed.
I think GPs will find that new responsibility challenging, because at the moment, of course, they're entirely for the patient, on the patient side, trying to get the best deal and refer them to where there's the shortest waiting time, the best service. If they become commissioners, then they have a whole new set of responsibilities about the managing in the best way and rationing against their budget. And those two roles may not sit comfortably one with another, and it may leave patients wondering whether the advice they're being given is best for the patient or best for the funds the GP is managing. And I think that's not a good situation to put GPs in.
So although people generally trust their GPs in medical matters, they are unsure about the doctor's qualifications to administrate the budget for the patients. David Wellborn from the Centre for Better Managed Health and Social Care fears that this might have far-reaching consequences.
One of the nightmare scenarios could be moving forwards is that the level of trust in professions throughout the healthcare system could be eroded because of perceived vested interest as opposed to genuinely working together.
Another cause for concern is that the new reforms will result in a waste of resources, since the administration of the budget will be carried out by the top medical professionals, the GPs.
What's happening is we take those people who are very highly trained, very specialist, and we're giving them a responsibility which lies outside of their training, outside of their skills, by commissioning. And by handing over commissioning responsibility to them, yes, there is a risk of conflict of interest. There's some other risks of overloading that skilled resource. There's a risk of it actually costing more because you're using more expensive people to do those processes.
Potentially rising costs and growing responsibilities are not the only upcoming challenges for GPs. After the reform, complaints will also have to be managed by the GP consortia and no longer by the primary care trusts. While this change could be a source for conflicts of interest, David Wellborn also sees the advantages of this change.
Generally arise out of something that's gone wrong somewhere or other. Usually it's a misunderstanding. And the misunderstanding is put right by a dialogue between the two people who've had that misunderstanding. And if the GP is the cause of it, then the GP should be involved in that. The question is, if that doesn't then get resolved, where does it go? And I think there is a potential that putting the GPs at the heart of it will make them take more care to try and put it right before it gets escalated into the process. So it could be an improvement, or it could simply, as you say, give rise to that conflict of interest.
Over 90% of respondents to the GP Patient Survey 2009-2010 claim they trust their doctor. This was prior to the new financial regulations and responsibilities factored in towards the end of last year. Many people's only point of contact within the healthcare service is their GP, so some patients may not notice any difference to the NHS. However, trust is an important issue and one that must be monitored carefully in the future, as the phrase conflicts of interest often arises within this debate. For Element Science, Michael Jones and Anke Lindemann.